Hello, my name is Alexia Barrett. I'm here to talk to you about health information management. The objective today is to explore and educate individuals about the up-and-coming field of HIM and analyze the use of HIM education during a course practicum. The content includes CHIMA and CCHIM, a code of ethics, education, Conestoga College HIM program, 1-month practicum project, how HIM education applied to the practicum, a thank you, and references. CHIMA and CCHIM. The Canadian Health Information Management Association, CHIMA, is the certifying body and national association that represents health information management and HIM professionals in Canada. The CCHIM, or the Canadian College of Health Information Management, was formed to provide educational standards and a professional certification for HIM professionals. Graduating from an HIM program does not give you the credentials to be an HIM professional. The National Certification Examination assesses the skills of an entry-level graduate from accredited HIM programs. Only successful candidates are eligible to use the CHIM credential and the title Certified HIM Professional. The Code of Ethics. Every CHIMA member has responsibilities to keep up the Code of Ethics. These include striving at all times to provide services consistent with quality healthcare, promotion, and prevention, striving at all times to protect the privacy, security, and confidentiality of healthcare information in any form or medium, perform duties diligently and offer only those services for which one is qualified, conduct oneself in the practice of the profession so that as to bring honor and dignity to oneself, the HIM profession, and the Canadian College of Health Information Management. Conduct oneself in an ethical manner consistent with the values of the Canadian College of Health Information Management and report any unethical practices to the appropriate authority. Strive to improve one's personal knowledge and competence through continuing education and lifelong learning. Offer leadership and proactive, innovative approach to advancements in health information management practices. Abide by the policies and the bylaws of the Canadian College of Health Information Management and actively support its strategic directions. Support and mentor students, peers, and colleagues to develop and strengthen the workforce and the profession. Respect the dignity and worth of every person. Education. There are only 2 accredited CHIMA degree programs in Canada. The first is at Conestoga College, which is located in Kitchener, Ontario. The degree is a Bachelor of Applied Health Information Science, a 4-year program, which has all necessary requirements for CHIMA certification, which are taught within this program. The second is Ryerson University, located in Toronto, Ontario. This degree is a Bachelor of Health Administration. This is a degree completion program. Therefore, not all necessary requirements for the CHIMA certification are taught within this program. Conestoga College HIM program. These courses include Health Information Management, Academic Communications, Health Informatics, Biomedical Concepts, Information Systems, Database Concepts, Solving Problems in Health Informatics, Governance and Structures of Healthcare Systems in Canada, Programming, Group Dynamics, Professional Communication, Introduction to Data Analysis, Clinical Systems, Health Informatics Field Studies, User Training and Adult Education, Web Application Development, Systems Analysis and Design, Research Methods and Statistics in Healthcare Sciences, Management and Organizational Behavior, Epidemiology, Population Health and Public Health, Information Technology Planning and Procurement, Project Management, Decision Support Systems, Security, Privacy and Confidentiality, Systems Integration, Visual Design, Healthcare Quality Improvement, Change Management, conflict management, as well as 4 interdisciplinary electives, a 1-month practicum, and 2 4-month practicums. During the 1-month practicum, I attended Guelph General Hospital. So a little bit of background on Guelph General Hospital and Conestoga College. GGH, or Guelph General Hospital, posted the following quote on their website about the collaborative work between GGH and Conestoga College. David Dornan and Doug Mitchell from GGH's Decision Support Department with Justin St. Maurice, a faculty member at Conestoga, brainstormed an opportunity to jointly teach a course in business intelligence, BI. BI is the science and practice of analyzing and presenting information to support healthcare decisions and provide feedback on organizational processes. With support and sponsorship from our BI solutions vendor, Information Builders, IBI, a unique accelerated course was created blending theory with technical skills. The practicum project was a falls risk assessment dashboard. We used Web Focus App Studio, a powerful and robust BI application platform, and data from Meditech intervention applications, which was the fall risk assessment, to create a fall risk assessment dashboard. This data available from the fall risk assessment we used to analyze the compliance of patient assessments and the number and type of interventions completed in order to ensure patient safety. How education applied to this practicum. The use of HIM courses at GGH. So in total, I feel that we used health information management, academic and professional communications, health informatics, biomedical concepts, information systems, database concepts, solving problems in health informatics, governance and structured in healthcare systems in Canada, programming, group dynamics, data analysis, and clinical systems. First, we're going to talk about health information management. Here, we learned data and information management, healthcare documentation, privacy, regulations, and confidentiality. In regards to the falls risk assessment that we have completed, we use data and information management using the Meditech healthcare documentation to provide a thorough understanding of how the falls risk assessment and interventions were used. Next, there was consistent planning, drafting, and revising documentation around the falls risk dashboard that we had created. Health informatics, we studied cases in the healthcare system where we were able to analyze problems and analyze data changes, and here we were able to create a dashboard that the hospital is actually able to use to improve their patient care. So our case studies actually came to life. Next, we had biomedical concepts. Here with the dashboard, we were able to draw relationships between documentation and clinical decision, as well as giving decision support new information and data so that they could analyze and strategically plan how they could implement a system and change it effectively to improve patient care. Data information systems. So the web focus application that we were using was a desktop computing. Often we came into troubles where we had to do troubleshooting and making sure that the system was correctly working. Next, we came into database concepts, which is the majority of the work that we have done. We were querying data, we were using SQL language, data manipulations, database models, and reporting the statistics and valuable information on the dashboard that we had created. Solving problems in health informatics was used as we were problem solving what information was most relevant to the falls risk assessment and interventions that were used. We were had to learn the process of how the documentation was being documented, and we were improvement thinking to think about ways we were able to use the data to improve patient care. Governance and structures in healthcare, which allows us to overly view the delivery of healthcare and how it was completed, so that we were better able to make decisions based on our information. Programming, we used a bit of JavaScript inside of our HTML so that we were able to produce different types of graphs and reports for the dashboard. Group dynamics. So this was a group project. There were 3 participants, so a lot of our time was spent leading one another and team building and working together very, very closely to make sure that this dashboard became available and was produced effectively. So often we had problems and conflicts between us deciding which was the most important aspects of the project, but we managed to work through all of those and our dashboard was quite successful. Next was data analysis. So we had to visually make sure that the information we were giving was statistically important to those who were going to be analyzing the information, as well as we had to make sure that that was quality data. So we did quality data checks between Meditech and the information that we were receiving once the dashboard was up and running. And clinical systems. So the systems that we used, as well as WebFocus, again, Meditech, which is the clinical system where the information is inputted into a computer system so that we were able to access the interventions and the compliance. Daisy is the web application where the dashboard will run live once completely finished. During the system, the Meditech was administrative and clinical for both functions, and we had to make sure that the importance of the documentation was good. So I'd like to give a special thanks to Guelph General Hospital for spending a month with us and making sure that we grew as professionals and we grew personally, which was fantastic. As well as I'd like to thank Dave, Doug, Adam, and Hannah for helping us all along on our way.